Well, happy chapter number 11, students. So now we are going to go ahead and jump into middle childhood. So think of elementary school age years. And so we're talking about the ages of about 6 to 11. And we're going to see that unlike our early childhood, our kids are going to slow down a little bit in growth. Remember when they were 5 and 6, they were really stretching out, right? That baby fat was kind of going away and they were getting very lean, and the BMI was lowest at that age. Well, now, again, our kids are still growing, but that speed or rate at which they were growing is going to slow down a little bit. 75% of our kids are seeing a dentist to take care of their teeth. However, that means 25% are not. And here in California, where we have access to Medi-Cal and other forms of insurance for low-income families, that's kind of a concern. It's a big concern because we talked about tooth decay being the #1 disease of our younger kids. And again, children from low-income families are less likely to see a dentist than those from middle and upper-income families. All right, so again, slower growth. However, they're going to get stronger, right? And this is when we want to make sure to be teaching these good health habits, whether the health we're talking about is nutritionally or it is going to be with exercise or physical activity. Both are really important. And oral health, again, is really important. So as our kids are in school, they get to be about first grade. And that's when I think is a really cute time because that's when they start to lose their teeth, as we see here in this picture on the left-hand side. So your kids will there will be a year where they just lose a ton of teeth. And that will continue to go throughout elementary school age years. And then we typically say when that process is finished, when a child's baby teeth have all fallen out and their permanent teeth are now in, that signals puberty, typically around the ages of 11, somewhere around there. Right, so again, when all of your baby teeth are out, permanent teeth coming in, puberty will be starting. All right, so again, we want our kids to be active, to play, to do all of those things, but unfortunately, we're seeing some barriers to that good physical activity with our kids. Stranger danger is something legitimate. In other words, we don't always want our kids out down the street playing without any adult supervision, right? Because we don't know who's out there or what's going on. Our after-school programs are focusing a lot more on their homework or academics, so that leaves lack of physical activity. Again, our schools in general, lack of access to good playground spaces. Right? A big one, though, the biggest one, is going to be that our children have kind of moved away from the outdoor physical play, and we're now at a place of really enjoying, I don't think of it as TV, I think of it as screen time. So watching 4 hours of television or screen time per day is associated with health problems later in life. Right? So in other words, if you have, I think it's healthy as a parent to have some rules about screen time, how much screen time is appropriate for their age. And so if your rule is something like you get 2 hours of gaming time, well, they can do their 2 hours and then they come to you and say, okay, now can I go ahead and go on my Nintendo or go on the computer and all that? Well, that's still screen time. And the problem is when they're interacting or at least watching screen time, they're sitting down doing nothing. Right? Most of our kids are not actually doing something physical while they're engaged in screen time. And so that's the harm with screen time, is that it leads to sedentary, which means just kind of stationary, sitting down, lack of physical activity. All right, sports. So typically, this is the ages 6 to 11 when our kids start signing up for all kinds of sports, soccer and baseball and all those different things. And there's some things that we need to be concerned about and aware of as we go through that process with our kids. And one of the reasons that our kids want to do this, and this is good, is because PE has really decreased in our public education system. So in other words, it used to be when I went to school, we had PE every day, 5 days a week, right? My kids had PE 2 days a week. And so the time frame and how much PE schools are giving is reducing it, and that's because they're focusing on academics or other areas instead. However, I will caution you that when your kids get into this world of sports, there's some things you need to kind of keep in mind and deal with. Number one is safety issues, injuries, right? My son, I remember he was like 9 or 10 and he wanted to play football. He wanted to play football. And I just was not for it. And the reason is because of the injuries that come with football. Remember, our children's bodies are not fully developed. And so it's just a great possibility. This football is a head-to-head contact sport. And so I was okay with flag football. Like, we can play flag football because flag football doesn't have that maybe tackling and possibility of injuries. But when I see little 5-year-olds playing football, it concerns me from an injury perspective. Another thing to be aware of is just that we think of, oh, sports is going to be great for our kids because they're going to learn sportsmanship. They're going to learn how to be good losers. However, be aware of your coaching staff, because I think it's really important to know the coaching staff. For instance, I've been to games and where I have seen coaches just literally yell, berate their players for missing the ball, and that's not positive. That is going to lead to low self-esteem in your children. And then I also run into those kind of what I call the psycho parents, right? Those parents that are literally standing up, sweating, yelling and screaming at their kid or other kids, offering to pay them money if they hit the ball. I mean, just all kinds of stuff that is just a little over the top. It puts a lot of pressure and stress on our kids, and this is should be a fun physical activity, right? So just be aware that you have some good coaching staff there. Right, we mentioned this last time, talking about the BMI, or the body mass index, and this is really concerning. We're looking at almost 20%, 1/5, 20% of our children ages 6 to 11 are already obese, not overweight, obese. That's a really, really big concern, right? So we need to, that tells us that we have overfeeding going on, we have lack of physical activity going on, and we need to be very concerned, because if you are obese when you're young, you are definitely looking at a kind of lifelong trajectory or lifelong path of continuing that habit, and unless we make some dramatic changes. Right, so again, obesity now causes more deaths worldwide than malnutrition. So getting too much food is now the problem. So again, this is why as parents, we need to be understanding of portion sizes. We need to be understanding of how to do snacks in addition to our meals, and what times to give our snacks, and how to kind of, take a nutrition class, right? So you can become more aware of how to do that. But obesity has increased primarily due to a couple things: watching too much screen time or television, and drinking soda. So it used to be, 30 years ago, the go-to drink for our kids was milk, right? Because we taught our parents they need calcium, they need to get milk. So our kids are drinking milk with dinner. However, we've moved away from that, and we have more kids drinking soda than we do having them drink milk or water or some good healthy sources of liquids. And so, have some type of rules about that, right? I am a big believer in being kind of not too strict when it comes to food in your home, because I tell parents, I've met families and they say, we don't do sweets in our home. We don't do any sweets. So my kid, we eat healthy. There's no sweets allowed. And what I find is typically if I were to go and look under your kid's bed or look in the closet corner, I would probably find a bunch of wrappers of candy. Because what your kids are going to do is when you have an all or nothing rule, they tend to just keep it from you, right? They're going to go to their friend's house because their friend's mom has snacks after school that are sweet. And so they want to eat there. And so they're going to do that. And so I think it's healthier to have like a happy medium. So like in my house, we have so many nights a week where we do dessert. I let my kids have a soda on the weekend. Yeah, I mean, one on the weekend is not going to kill you, but it prevents them from being kind of rebellious or upset because we never get to do anything else, right? The rest of the weeknights, they have milk and water, and really water primarily. They're really, really happy with that. So I've taught them some good habits, but I also want to be a little lenient with, okay, when we go to the movies, we get popcorn and licorice, we like to have a good time at the movies. It's a fun thing. And yeah, we're having some sugar, but it's not something that we do often, right? So kind of do that, but be really concerned about your kids' screen time use and their drinking soda. Something that we see come up during these years of 6 to 11 is asthma. So typically we talked before about pollutants and about environmental hazards and how we need to be aware of that. But it's usually after the age of 6 that we really start to see our kids need an inhaler or have asthma to the level that requires some medical assistance, right? And asthma is basically, it's inflammation of those airways. So it makes normal breathing a little more difficult. All right, and brain development. So think about this. Your brain development, our brain development, continues. Although our school years are the time that we do a lot of learning and teaching, like during this process, and kids love visual learning. So that's why they love screen time, is because that visual, just like you might prefer to watch the video than just look at PowerPoint slides, because there's a visual component that we are kind of drawn into. And so our kids love that. However, understand that our brain continues to grow throughout life. So there's no age, like say 60 or 80, where our brain starts learning or developing. It continues all the way up until before we die. All right, so let's talk about IQ. So most of us understand an IQ is a somewhat supposedly a test of your intelligence, but it's really a test of your ability to learn that information, right? The average IQ is about 100. If we look at this slide here, we can see, 70% of us fall into that bell curve, with that average being 100, yet people like Einstein and others are way out there. Einstein at 160 plus IQ, right? So very intelligent. However, I'm going to really caution you here, because I don't put a lot of stock or weight into somebody's IQ test or number. Because what I've learned is that the tests themselves, the IQ exams and other tests that we all take, are heavily influenced by culture. So what do I mean by that? So think about this. When you would sit down to take an IQ test, right? This is a test of intelligence. Who do you think comes up with the questions to put on that IQ exam? What do you think is the makeup of those people? Well, if we look at this slide, they're probably people sort of like Einstein. So these are like doctors who went to Stanford and Harvard, and they're super smart, right? And they come up with all these questions, right? They may be white, they may be primarily males, and they're coming up with questions on an exam that you and I may not be able to answer, not because we don't have the intelligence to answer the question, but because we don't really get the question, or the question doesn't ring true for us. Because when these individuals develop questions, they're basing it on their life experiences. And the life experiences of a white male who's upper income and had great exposure to the arts and sciences and all of these things that maybe those of us who come from low-income families have not had, may be very different. So that's why, again, I don't put a whole lot into what that number is. All right, talking about the school age years, let's talk about a proportion of students that we see that have what we call ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. That means, again, it is difficult for the child to give their full attention for a long period of time. And they also have this difficulty being stationary for a long period of time because they're hyper and they want to be moving, right? And what we've learned about these kids is that they learn so much better in this type of environment that we see on the slide. So when they're doing something physically, right? When they're building with Legos, right? When they're assembling blocks, when they're making something with their hands, the learning process is good for them because they're able to, again, be up and about and be physically active, and they're able to kind of learn in that way. And so it's a real challenge for our kids who have to deal with ADHD. So let's talk about what we're doing about it, right? So ADHD is, the rates have increased over the past decades here in the US tremendously. We've had a really big increase in the number of children we're diagnosing with ADHD. Now, here's something really fascinating, is if you study psychology and if you study sociology, you learn that there is no biological marker for ADHD. In other words, if we take a blood test, it doesn't tell us you have ADHD. There's no test. Biologically, that tells us this patient has ADHD. What we do is we observe the patient. So typically, I at one point thought my son might be hyperactive, have ADHD. And so I was sending him to Kaiser. And what they said is what they do is they actually have a questionnaire, big, long questionnaire, that the guardian or parent fills out. They give a questionnaire to the teacher, and the teacher fills it out. And then the child goes to see a therapist or a counselor. And the counselor assesses them. And they look at all three of those things, and they make a judgment on whether or not they think this child has ADHD. That's how we diagnose them. So it's not a real perfect science here, right? And so we need to be aware. And in my case, and in lots of moms' cases, I think, boys tend to have a lot more energy than your girls might. And so, sometimes they go through these phases of just having a lot of energy. However, they're not in this ADHD category. So what do we do? Because ADHD is considered special ed. And so if your child has ADHD, they actually have some benefits as far as the school is concerned. But what we do with our kids is we tend to drug them, right? So there's a couple different ways we can treat ADHD. Number one is counseling. So number one is going to talk to someone who can help you work through your feelings and give you coping strategies so that when you have all this energy, they can give you ideas on what to do, right? Number two is medication. And Ritalin is the most common form of medication that we use. Understand, Ritalin is similar to a street drug, similar to a speed drug that we are giving our kids. And it's a fine balance when we use drugs in general, right? Because, excuse me, what we need to do is we need to find this balance where our child is getting enough Ritalin that they're not exhibiting that hyperactivity and they can focus a little more. However, we also don't want to give them too much that all of a sudden they're like lethargic and all of a sudden they sit down and they just don't want to do anything, right? We don't want to create zombies. And so that's why it is controversial whether or not, we give medication. It's controversial in the sense that doctors are kind of pro-medicine, they're for giving drugs, and parents are like, no, I don't want my kid to have drugs. But here's what I'm going to say. If you don't want your child to use drugs, then you need to be using what we call behavior modification or behavior therapy. For instance, I think I've shared with you one of the boys that I mentor in the program with the county probation department. His name is Chris, and Chris is in 6th grade, and Chris has ADHD. And Chris also has PTSD, and he has a lot of different issues, right? And so with ADHD, when I talked to Chris's mom, because what happens is when I would go in the classroom to observe Chris, he just can't sit still. So when it's time for the test or it's time to sit down, he gets up and he goes to his friends and he starts using his pencil to knock on their heads, and he's kind of going all over the room. And this poor teacher has like 5 kids in her classroom that have ADHD. So now how do you manage or control a classroom and do learning when you have 5 boys that are up and about and kind of doing their own thing? It's really challenging. So when I asked Mom, what are we doing to help Chris with his ADHD? Mom says, well, I don't want to use drugs, but Mom's not doing anything else. So that means basically Chris struggles with the condition with no help, and that's not okay. So I tried to teach Mom, this is what we do with behavior therapy. So let's say Chris comes home from school and he's got some homework, right? Chris sits down for his homework, and normally this is what his mom does. She says, you sit down at the table, you need to finish all your homework, and then you'll be able to go outside, but you can't leave the table until you finish all these pages. Okay, Chris is not going to be able to sit there for 2 hours and do homework. He's not. First of all, my Chris, he's reading at a 1st grade level in 6th grade. So he has been passed up because we don't fail kids nowadays like we used to. We basically just kind of pass the problem up to the next grade. And so he's in 6th grade and he's reading at a 1st grade level. So when he looks at a math paper or an English paper, he thinks he's reading like Chinese. He doesn't know what language that is because he's at a 1st grade reading level and you're giving him a 6th grade worksheet. And so he can't. So how frustrating is that for him? And so I tell Mom what we should do with behavior therapy is Mom should sit down with Chris and say, okay, Chris, let's go ahead and go through the first 3 problems together, and then you get like 10 minutes of outside time, okay? And so Mom goes with Chris and she shows him how to do the problem because he really probably doesn't know. And so she said, this is how we do the math problem, okay? Let's do the next one together, and we'll do the next one together. Then Chris gets his 10 minutes of basketball, right? And then she says, okay, Chris, time to come on back, and I'm gonna show you the next one, and I wanna see if you can do a couple more on your own. And then we get our outside time. So now what you've done is you've taken a big job, which is to do homework, and you've broken it up into small pieces, and you've done it with him and not left him by himself, where he feels like a failure. He feels like, I don't know what this says, I don't know how to do it, and I'm just frustrated, right? And so I tell parents, if you don't want to do drugs, then we need to use behavior therapy. We need to have changes in the home and school environment that help this child. Because we're giving, as we see down here, 2 million of our kids and adolescents, we're drugging lots of our kids. Drugging lots of our kids, unnecessarily sometimes, right? The foster youth that, one of the foster youth that I've worked with, you know, when she was 11, she was diagnosed as bipolar. And she was put on heavy psychotic meds. And because they want, basically because she was acting out and they wanted to pacify her. She's not bipolar. It's pretty scary to get a mental health diagnosis and realize that that's an incorrect diagnosis. So we're drugging a lot of our kids, especially our kids in the system. All right, a learning disorder. So learning disorder is, again, these children would be classified as special ed, and it's when there's something in our brain that doesn't process or learn the same way many people do, right? So there's a deficit in a particular area of learning in our brain, and it can be a real struggle for our kids. When we talk about the most common learning disability is dyslexia. So what's going on with dyslexia? Is basically when a child looks at a page, or when you and I look at a paper, we tend to read from left to right, right? And with dyslexia, when a person looks at the paper, there's kind of a disconnect between what our eye sees and what the brain processes. So when the child looks at the paper, the words are jumbled. And the words don't go from left to right in a sentence that makes sense to them. So they're struggling to understand what is written on the paper, right? That's dyslexia. And there's some aids, as we can see in this picture here. It's pretty cool. This kid has some glasses, and what the glasses are doing is they're using this prism to focus the words in a certain way that your eyes then send the correct message to the brain, and it can process better that way, and they can see from left to right, right? But it is the most common learning disability. I mean, 1 in 5 kids have dyslexia. Autism. We won't talk a lot about autism, but autism is another form of being special. And, you know, I will say when it comes to autism, think of like this whole long ruler, and there's different places on this ruler you can be with autism. There are those that can be extremely high functioning. Autistic kids, they can be brilliant when it comes to math. They can be brilliant in many different ways. Some of the things they struggle with are going to be socially. And so socially, they may have limited speech engagement, and they definitely have limited eye contact. And so it's difficult for them to maintain eye contact with you for any given kind of length of time. So they're typically looking down or looking somewhere else, right? And then they tend to have a repetitive motion because it's comforting for them. So in other words, if they swing their arm all the time, or they go back and forth on their feet, it's because that's a comforting kind of a process for them, right? So again, autism can be on that spectrum, anywhere on that spectrum. You know, for parents, it's a challenge. It requires you to learn some of that behavioral therapy that I just mentioned, and learn how to work with them and help them to manage these feelings that kind of come out in different ways. All right, so let's talk about special ed. So special education in schools is very different today than it was when I went to school. Right? When I went to school, I remember in my elementary school, I remember that I knew that there was one classroom, and that's where all the special kids went. That was like the special education classroom. We no longer do that today in schools. So what that was called a self-contained classroom, meaning I'm containing in the classroom all of the special ed kids. We don't do that today. We do today what we call mainstream, which means that most of our special ed kids are going into the same classrooms as the other kids who do not have special needs, right? So they're not taught in this Self-contained room, they're taught in what we call the least restrictive environment, which is just a normal classroom. Now, understand they may be getting help or assistance in that classroom. So for instance, all through my daughter's, one of my daughter's elementary school years, she had a blind student in her classroom. And this blind student, you know, was in her classroom like with the other kids, but she had a full-time one-on-one aide. And so every day there was a worker with her. And so when the other students were all kind of going up to the board and they were writing math problems and they were doing math, the aide would work with this special needs girl, and what she would do is she would maybe have rocks on her desk or different things, and the girl would feel, and she would make math problems using something that she could feel and understand, right? So she learned a little bit different, but she was still learning in the classroom, and there's several reasons we do this. Number one is that if we put all of the special needs kids into one room, well, their needs are just completely different, and so it'd be difficult to manage all those needs. And number two, it brings a whole lot of awareness, empathy, and kind of working together with all people into our elementary school. In other words, my daughter and the other students, they had to learn to assist this young student. And they had to learn to help her in many different ways. And that, again, is helping us to be an inclusive kind of society. All right, so make sure that you go ahead and look through your clicker size as we talked about the kind of bio changes going on with our middle-aged children. And we'll see you next time for Chapter 12 when we talk about cognitive development in our middle-aged kids.